Hey everyone, it's Dr. Ariel Bonert from Victory Spinal Care Cape, and today I wanted to talk about a couple of indicators that might mean that your child could benefit from upper cervical chiropractic care. So one of the biggest things that we look for on day one is to see if your child has a head tilt preference. And a lot of times that means laying with them on their back, seeing if they can turn their head even both directions. But something that you can look for at home to see if your child has a head tilt preference is when they're sleeping, when they're laying down, when they're doing tummy time, when they're sitting in their car seats. Do they always look like they have their head turned to one direction, or do they use both sides uniformly? Also, when they're breastfeeding, do they latch well on both sides, or do they prefer one side more than the other? All of these things could indicate that there could be a misalignment present in the upper cervical spine. Atlas or C1, that top vertebrae in the spine, controls roughly 60% of our head rotation. And so if there's a misalignment present, this could definitely limit range of motion for these kiddos. Another big indicator that you can look for is to see if they have a bald spot present on the back of their head. If a child has good head rotation and they're looking side to side while laying on their back, their bald spot is going to wear fairly evenly. But if it is more prominent on one side versus the other, this can lead to a condition, a flattened head on that side, which is what we call plagiocephaly. And this can sometimes lead to children having to wear helmets and other interventions like that. But if we can catch things early, if we can correct that misalignment, restore their normal range of motion to their head and neck, a lot of times we can reduce the need for other interventions down the road. And the other thing is that if the head is only able to turn to one side, it can also inhibit brain development and just how they grow and develop through their lifespan. And so for all of these reasons, we want to make sure that your kiddo's nervous system is functioning optimally, that they have proper head movement and rotation. So if you're noticing any of these indicators with your kiddo, we would love to assess them and check them out for spinal misalignment. You can give our office a call at 573-334-0100.